Well, 3 years as a doctor, cannot even believe that we got here. Let's go through let's go through everything that I learned this year and reflect on the time we've had so far. We've still got about a month or so to go, so it's not completely over because, as you know, we all hand over at the start of the year, around about February or so. So we still have a little bit left, but it's almost the end of 2024. So let's reflect on the third year I've had as a doctor, everything that I've learned, and maybe, who knows, you guys can learn some stuff as well. Let's get into it. So I think one of the main things that we learnt this year is just how to operate as a registrar, which is a big step up for everyone. And essentially, if you don't know what a registrar is in Australia, we have a few different ranks of doctors. They start off at intern, which is the first year doctor, then you go up to resident, and then you actually go up to registrar after that. And you can have a few different types of registrars. You can go to an unaccredited registrar, and then you go to an accredited registrar. All that means is that if you're an accredited registrar, you are on a training program, you essentially are training towards a specialty. And those who are not accredited, like myself, are essentially just sort of doing the same thing, but with your training wheels on. You're still trying to get into that specialty, you just haven't got accepted or you haven't applied or whatever. So you're operating in a similar type role, but you don't have the pathway yet to become a specialist. And that's a little bit different to other systems around the world. So here in Australia, this is what we do. We have a bit of a limbo period where you are trying to get onto a specialty, a training program, trying to become, an expert in that field, but you have to apply, then you go on, you get accepted, and then you start training towards that specialty. Regardless, working as a registrar is a completely different ball game compared to working as a resident and then compared to working as an intern. Whole lot more responsibility, which I don't think I have to tell other registrars out there that you just automatically assume, and you have to just adapt and become a whole lot better and more efficient at your job. And it's a really, really good learning experience, I think. And some of the best learning that I've had is just being forced into that role where you are essentially having to act as a more senior colleague. You are now responsible for interns, you're responsible for residents, you're responsible for communicating with consultants, and that does come with a bit of responsibility. You are essentially the spokesperson for the consultant, and you have to communicate that to your other staff, your colleagues, the residents, the interns, and you need to make sure that things get done. And that's mainly the role of the registrar, is a much more senior directionalist approach to the patient care. And I don't know, I think that's a bit scary to sort of try to just, it's a little bit scary, it's a little bit nerve-wracking to feel like that on day one, and you certainly don't feel like a registrar when you are working as one for the first part of the year. I didn't, to be honest, and it took me a while to sort of move into that role. You have one foot in a resident door, and then you have one foot in sort of the registrar door, and you need to be able to transition from the resident mindset to the registrar mindset. And it takes a little bit of time, It's not as easy as transition as you may think. Or it may be as a difficult transition as you may think. But it's just the basic things. You're now leading the ward round. You're now essentially communicating the plans to the consultants. You are preparing operating lists. You're doing operations with supervision. You are taking referrals, you're giving advice over the phone, you're escalating if that's appropriate, you're also receiving information from other colleagues, and you have to triage that and say, well, is that good enough? Do I need to see the patient myself? Do I actually not agree with that? Do I need to have a second look at things? Do I need to actually correct the person who's telling me this information? All these things that come into play that you probably had no decision making power of whatsoever last year or the year before. So I think by the very nature of the job, it's a big step up, and you need to learn that like as soon as you can, that it's a whole different ball game. And I don't know. I think it's like a bit of a step up, and you have to assume this role of responsibility. So I think tying it all together, the one thing that I really took home this year is the ability to think like a registrar and separate that from the thinking of resident, because it's a completely different way of thinking and it's a completely different role. Yeah, and I think that's just one thing that like you have to just accept and embrace. And it takes a little bit of time, but you get used to it like anything. And by the end, I think like by now, I think I am thinking more along those lines, and it's good fun. I think I much prefer life as a registrar than as a resident, but I don't know if other people feel like that, but I think although it's a lot more work, you do get a lot more benefit out of it. That is pretty much the second point, which I'm going to touch on, which is how you can level up so much when you're in this role. And it's really, really satisfying when you start to do that. I think that when you start to really assume that role of a registrar, you start to level up because you're exposed to more opportunities. And if you take on those opportunities, that is essentially, the space where you get to learn and grow and just become a better doctor and a more senior doctor, which is the most fun. And I think in terms of a surgical mindset and a surgical sphere, if you start to just be around more and take on more opportunities, see more patients, you'll naturally get exposed to more opportunities in the operating theatre. And when you become more familiar with the operating surgeon, they will allow you to do more parts of that operation. You'll be able to essentially perform it, by yourself if you're able to, and if you have the required skills, and if the supervising consultant is happy with you doing that. And I don't know, I think for all those junior doctors who are like, I think I want to do surgery, being able to do that and essentially have more authority, more independence, more autonomy, that's the best thing. Like, you sort of want to be able to do as much as you can with the supervision and the safety net of a supervising consultant. It's kind of a scary thing, right? You want to be able to take on as much as you can, but I think for anyone who's been in that situation in theatre where you're the one who's the primary surgeon, the primary operator, you're taking on all this opportunity, and maybe you get into a roadblock in the procedure, maybe you can't progress and you need some help. Having that person there in the room or right beside you scrubbed, that's the best way to learn, because you're able to recognize the problem, stop, escalate appropriately, and then proceed with the operation safely. And I've had that happen a few times where, it's because you're not an expert in that field yet, so you try all the stuff that you can do safely, and then if you cannot progress or you can't, do the next step, or maybe something's not quite working right, you essentially just stop, and then you get some help from someone more senior. Yeah, I think it's like tricky and naive to think that you're going to know how to conquer every little challenge that pops up in your training. And whether it's not surgery, whether it's something else, and you haven't seen this constellation of symptoms, or maybe don't know how to interpret this scan or these blood test results, You need expert help, and that's what the consultants are there for. And being a registrar is kind of like being a senior doctor, but with training wheels on. And you're trying to do as much as you can. You're trying to do all the things that a consultant would do, but you can't do them yet. And you can't do them independently because you just don't have the expertise and you don't have the experience and all the knowledge. So I don't know. I think the world's the oyster because the registrar is exposed to as many opportunities as they want to be exposed to. And if you just allow yourself to be a sponge and you learn from as many people as possible and just say yes to all these opportunities, then, I mean, I don't know, like, what's limiting your ability to level up and do this operation? Well, it's just like time, right? So I don't know. That's what I've really taken on this year, I feel, is that I've put so much time and effort and energy into learning things and becoming good at them and trying to level up as much as I can. And because a registrar naturally just exposes you to more things, provides you with access to consultants, gives you access to opportunities, you can essentially do all that as much as you want. You know, everyone's always looking for help. Everyone's always looking to have another person do the work for them and, you know, see as many patients as they can because at the end of the day, it's a lot to do. So if someone can help you out and see your patients, do the operations, you're gonna let them if they can do it safely enough. That's probably the second take-home message that I've learned this year, is that you are given so much access to opportunity that you should just take all of it on and you will actually level up so much. And that feeling is like very, very satisfying, because I know when you first start out as a junior doctor, you are, confronted with all these things that you don't know and you don't feel comfortable at, and to sort of slowly get the feeling that you know a little bit about what's going on, because it can be very humbling when you think you know what you're doing, even in a couple of years as a doctor, and you're like, oh, I've seen this presentation, I know exactly what the diagnosis is, or I know exactly how to perform this simple operation, and then there's a roadblock that's unexpected. That's the most humbling thing. However, you will actually become a bit better over time, and that feeling is a real game changer, I think, from a junior doctor standpoint. It changes how you look at things, and you are not all the apprehensive med student that you were at the whole start of this journey. You're actually becoming a more senior health professional, which is a good thing. All right, let's go on to number 3. The downside of this whole leveling up cascade is that you are also exposed to the whole realm of burnout and work imbalance, which is a whole nother topic and can of worms to get into. But yeah, let's go into it. It's an interesting one, right? Because naturally, when you go into a field like medicine, as much as all the other fields out there, there is a level of competition and a bottleneck that will, guide selection into certain fields. So I guess one thing to touch on is that the more work you put in, the more time you spend leveling up, getting to know people, seeing patients, everything like that, the more people are going to see how much you care about the job and care about your career in that field. You're naturally going to want to give them the opportunity and reward them for their efforts. And it's not just the hard work aspect of it. You have to be able to be moldable. You have to like people. You have to be liked by people. You have to have a good patient interaction and bedside manner. There's a whole bunch of skills and everything that you need to have to become like a well-rounded and good candidate for selection. So there is the aspect of it that there is so much consumption of the medical field that the person can become a bit burnt out by the end of it. And I think certainly throwing yourself into the deep end, doing as much as you can, and really just, putting all your efforts into that can have effects on your health and well-being outside medicine. And I guess you sort of get exposed to it this year. I think I sort of have touched on it a bit, and it's, you're going to have to make sacrifices wherever you go. And if you're keen on something and you want to put time and effort and energy into it, I think go 110% into it, because you will actually get so much out of it. And anyone who's ever achieved something or, become successful at whatever has put a lot of effort into it. And, there's always other people who think, well, oh, they're just lucky, or they just, it's just them, why is it not me? Or so it can be a different mindset for those people who don't get those opportunities or don't have those achievements. And it takes away from the time and effort and energy that people, put in to get to those. And I do think that you do need to create a bit of imbalance, and you do need to work to get that life balance at the end of it. So I think don't hold back, but also try to just incrementally adjust. And that's probably the best way of going about it, and having someone to check in with and really just bounce ideas off, because you should validate how you're feeling at that time, whether it is that you've hadn't had enough sleep that day, or you feel like you've worked a bit too hard this week and you haven't had time for sport and exercise like you normally do, or you haven't gone to a family event in a while, or seen this friend that you usually see every week for 3 months. So there is some push and pull with the job, and naturally as you become more senior, and especially as you transition from a junior doctor into a more senior doctor role, you will progressively become more consumed by the role. And yes, that's part and parcel of it, but you have to just incrementally adjust, I feel, and take stock about how you're going, and not completely reject the idea and say, well, I can't do more than 40 hours a week of work, because sometimes the job requires you to do more than 40 hours a week of work. But also taking stock and saying, well, because I've worked this much, that probably means that I need a little bit more sleep, or I need to cut back on a little bit more other stuff that I would normally do, whether it would be going on an 8-hour bike ride on a Saturday, or going to 3 events on the weekend, maybe cutting it back to 2. There's push and pull with everything, and everyone is going to have their own way of doing it or dealing with that sort of balance or imbalance that you can create with work. And yeah, life in the medical field is no different. It's very well documented about burnout and work-life balance, and there sometimes being a lack thereof for people who want to get into certain specialties and whatnot. But yeah, I think it's changing for the better. People are getting paid overtime, and they are slowly getting rewarded for their time and effort, and the whole landscape of it is changing a bit. But on the other hand, there is a real place for working hard and really putting the effort and energy into pursuing what you want to get good at. And there's no substitute for that. So there's no substitute for going and seeing 100 patients for that week, or going and speaking to this person or that person, or spending the time in the operating theatre learning the procedure and researching the equipment beforehand and actually putting the reps in over and over and over again. So yeah, mixed feelings. I think that is just part of the job and part of any role where you become more senior. You have to get good at it, and the only way you do get good at it is putting in the time and reps and the effort into it, much like you do it for anything else in life with a skill, whether that be cooking or playing a video game or learning how to drive or, I don't know, woodworking or some sort of musical instrument. The more you play it, the more you do it, the more time and effort you spend on it, the better you're going to get at it. So with medicine, it's no different. I think you can progressively reach a space and a mindset where you're leveling up at a sustainable rate. And I think that's not a bad way of thinking about it, that you can actually level up without completely burning yourself out and sacrificing everything else in life. But there are needed to be sacrifices to be made. Yeah, that's been an interesting lesson, I think, but albeit a very, very good one, and probably something I'm going to have to get better at over time, even more so. So yeah, that's the third takeaway. We've got one more to go, and then we can wrap up this year review in a life of a registrar. So I think the last thing we should touch on is the role of the registrar in essentially setting the tone for the team. And you're now the head of like the team on the ward, and you're dealing with the consultants who are mainly off-site or off the ward, not seeing the patients, and you're the head of the team, which may consist of residents or interns or whoever, and you're essentially having some responsibility for setting the standard of how things should be done and what you want the patients to have done, how you want the team to operate. Do they need to write this down for the notes? Do they need to chart this medication? What if they don't chart it? What if they miss doing a certain thing? What if they don't get a scan done or rock up on time? Or, maybe some clarification needs to be done for a misunderstanding of a medical condition, etc. So I think that it's an interesting change in how you may usually operate at work, and I don't know, I feel like it's an interesting space to be in, because now you're more of a boss rather than a colleague. And it's interesting. You have to maintain that sort of like separation a little bit, and you want to have fun and everything, but then you want to make sure that the patients are getting the best care and that everyone's operating in the most effective manner. And I would definitely wouldn't say I'm an expert by any means in that area, but if something doesn't get done to the standard that you want to get done, you need to come up with a way that can change it and can actually make the change better in the future, etc. So having that ability is really, really important, I think, when you start to level up in this role and you're now making the change and making the decisions, as opposed to getting the decisions and getting orders or having requests and saying, well, you should go and review this person, or you should do that medication, or can you please do this? So you're in charge of making things run as efficiently as possible, which I think is good, because you have now come from a role where you're being a resident or whatever, and now you can see, oh, I know exactly what this person needs to do at that time in order for me to get good at the role that I want to get good at. And in order to do my role efficiently, I need them to do X task efficiently and on time, and get this task done on this day, etc. So I think that's the way I think about it, right? Like, you're leveling up through the healthcare system and progressively going through the different stages of being a doctor. And you can see how each person in each role
affects the outcomes of the patients. And if there's deficiencies or there's little lapses of concentration or mistakes at certain parts of that hierarchy, then they still affect how the patient, gets treated, what their outcomes are, etc. So being able to have that knowledge and that awareness of everyone's role in the healthcare sector is super, super important. And nonetheless, as a doctor, you're able to sympathize with the position of an intern or a position of a resident. And now, as a registrar, you can understand where registrars are coming from. So it's good knowledge and exposure, I think, to have the ability to understand where other people are coming from. And the more time you spend in the healthcare sector is just, more information, more knowledge. To make better decisions for everyone involved, including yourself and your team members, as well as the patients and other staff. So I think that's the last takeaway, right? That is really, really important, in that as you move through different roles as a doctor, you're able to understand where different people are coming from, and you're able to sort of, empathize with their position a bit. And you understand that an intern is at this level and can only do A, B, and C, and you're not expecting them to operate as a resident. So if a task comes up and it's not the intern's responsibility or within their wheelhouse to deal with, I wouldn't be expecting them to deal with. I'd be expecting a resident to deal with it. And then if a resident comes into problems with X, Y, and Z, and they should escalate to me as the registrar, and I'm able to solve the problem for them. Or if I'm not able to solve it, then I need to go to my consultant. And it's all these, delegation and compartmentalization of the doctor's role in the hospital system, and being comfortable with allocating different people different responsibilities. And yeah, I think as a registrar, you're in charge of coordinating that to an extent and following up on things, and having a different position within the role of the team. I think it's a really good change, I feel, and I really like how it all sort of works and fits together. But it doesn't always fit together very smoothly at the start, but you get good at it over time. So I don't know. I think wrapping it all up together, it's been an interesting sequence of the year, and with anything in a new role, you get better at it over time, and then it's a big step up, of course, but you learn heaps along the way. And by the nature of a registrar, I think it's a really, really cool thing to be exposed to more opportunities, be able to level up. And I think from a surgical aspect, for sure, you get to do more operations, you get to see more clinic patients, you get to learn more, and just see how it all works, which is exciting stuff. And you move away from that role of a junior doctor and start to have just a little bit more autonomy with how things get done, albeit there are obvious, still limitations of your expertise that you have to realize and accept. So moving forward, we'll see how we go next year in a slightly different role next year, more of a non-clinical research type year, which could be exciting. But that's what I've learned this year. So hopefully that helps. Let me know if you have any questions about anything that I said or any points of view that I took. And if you've been in my role before, or a role similar, or you're about to go into a role like mine, I'd be really keen to hear what you have to say, and if you have any questions, etc. So do let me know. Otherwise, I'll see you next time. Bye.